So hello, how are you?
I'm well, thank you. How are you?
I'm good, I'm good. Thank you again for spending time with us today. I was wondering if you could just introduce yourself and also tell me a little bit about yourself from a professional point of view.
Great. Well, my name is Joel Shapiro. I'm a psychiatrist. I work here in Toronto, and I work in an outpatient practice that's called the Medical Clinic for Person-Centred Psychotherapy. And I work with anyone 18 years or older.
Awesome.
Yeah.
So what has motivated you to volunteer at Ellie's Place?
Well, I do have a personal connection to the Coopers, who are the founders of the charity. And I think them, knowing my background, it was sort of like a logical fit when they were getting the charity up and running. And I think when their first board of directors, they had another psychiatrist, and then there became sort of a gap and a need for a psychiatrist to join, and I was happy to fill the role. But personally, I mean, it's exciting to be a part of something that's sort of starting something brand new and to get on the ground floor. And in my personal work, because I'm mainly working with people in an outpatient setting, I see that there is a need sometimes for more than what I can provide in my office. So
Mm.
I'll be talking to some folks and realize that it would really be beneficial if there was something more intensive. And obviously, Ellie's Place would be something very long-term and intensive that could really help to help someone develop long-term skills over an extended period of time, which I think is a great need. So yeah, those are the main factors of what brought me to Ellie's Place.
That's awesome. Out of curiosity, when you look at like psychotherapy, how do you think that will unravel in a long-term treatment facility like Ellie's Place? Would it be similar to what you're doing right now, or are there going to be some differences?
Yeah, I think there's going to be differences for sure. So when you're doing psychotherapy in an office setting, you have about an hour of time to spend with someone, sometimes more, sometimes less, and then oftentimes the person then goes away for a couple of weeks to mull it over and think about things, which is good, and really is the right fit for a lot of people. But I think with Ellie's Place, it's really this opportunity for people to be gathering and more living as a community, which would be a totally different dynamic. So I
Mhm.
think it's really something different altogether, right? Because they're going to be having all these interactions all the time, and elements of that are probably going to be like psychotherapy, with teaching skills and exploring events from the past and whatnot. But it's more than that. It's also going to be directly experiencing, learning new skills, learning leadership skills, and things like that.
Mhm. I guess it's like looking at the person and trying to figure out what their needs are, and there's different things out there, but there's definitely,
Mhm.
again, that gap in the market, excuse me, and I think Ellie's Place fills that. Well, awesome. I guess with that being said, what would you like to add to this conversation around mental health?
Well, I think that one thing I like about Ellie's Place is it really focuses on kind of the person participating in the therapy as like an active participant. Really the people that are going to be entering into Ellie's Place are going to be um, learning new skills, but they're going to be working really hard. And I think that sometimes one of the things that folks struggle with when they enter into psychotherapy is they're sometimes a little bit caught off guard and surprised by how much effort and work you have to put into the process, right? And I think that it's really important for people going into the program to understand, yeah, they're going to be really working hard, and it's through that hard work that they're going to be developing recovery. Because the harder we can work and actually succeed and see results, that's what starts building up confidence and leading to self-esteem, because someone can feel like they've really achieved something and accomplished something. So yeah, I think sometimes that gets missed, especially you're waiting a long time to go see a doctor, and sometimes folks aren't sure, aren't seeing how they're going to be adding to their own treatment, right? So it's up to the therapist to say, here's what I'm going to give you, and then you're going to take it away and use those skills and build on it, so that you can work towards building your own kind of recovery and your own self-esteem.
Yeah, that's definitely an interesting perspective because it does have to come from the individual. They have to want to get better and put
Yeah.
that time and that work in. It's not just all the other resources and support around you.
Well, I think it's both. I think the analogy I like to give folks to sort of set the stage is it's like going for piano lessons, right? if you have an excellent teacher, you're going to do better than if you have a lousy teacher, right? But if you're not going to practice, it doesn't matter who your teacher is.
True.
So
True.
you really need someone who's invested and cares and is going to put in the time to teach you, and then you need to take that away and apply it. And then together, you need both. You need the combination of both. You need a dedicated teacher, and you need a a dedicated pupil to build up the skill.
Yeah, for
Yeah.
sure. Another question actually just popped to mind too. I think when we look at education and education around mental health, do you think that there's more opportunities for growth within that specifically, like educating people more about what's out there, what it looks like for someone to live with a mental illness, right? And that also relates, I think, to the stigma too. So do you think there's a lot of work to be done in that space?
Absolutely. Yeah. I mean, I think that more people are talking about mental health more than ever. Um, it's not uncommon for people to, tell me that, that they're talking to their friends about their therapy, right? Like, I think years ago that would be an unusual thing, but often I'll be working with someone else and they'll say, oh yeah, I was talking to my family and my friends about the therapy session. So it's not, I don't think it's as stigmatized maybe as it once was.
Mhm.
And people are more informed than ever before. I mean, I often, you know, give people some suggestions about things they might look into, and they come back having done their own reading and their own research and sort of educating themselves. And I think that there's a lot out there, like TED Talks and YouTube clips and all these things that people educate themselves with. But there could always be more, and even some initiatives that are being done to even introducing young kids to concepts like mindfulness. I know there's initiatives in the school, like to try to teach certain types of really helpful skills early on
Mhm.
so that people can have those kind of coping strategies and educate folks just about mental illness. And so I guess to answer your question, like I feel like we've come a long way and there's a lot more to be done, but I think we're kind of like getting there. We're on that path.
Excellent. Yes,
Yeah.
I completely agree.
Mhm.
Okay, so I guess our last question is, what does our Ellie's Place tagline mean to you, where recovery grows?
So I like the metaphor of sort of growth and recovery, and I mean it fits obviously with Ellie's Place because a big emphasis is on farming, and that's one of the main sort of the idea of building life skills, but in a rural setting, getting people fresh air, getting this community developed outdoors. So I think that the growth metaphor sort of alludes to actually what they'll be doing in a literal way, but I think just as an analogy to sort of describe mental health, oftentimes in the quote that I gave you, I assume that'll be posted somewhere, it's about planting seeds and growing. And I think it's a commonly used metaphor in mental health because again, it speaks to a few things. It speaks to, putting in effort and work at the outset, not getting a reward right away. Right away, you just get a big pile of dirt, nothing. And then you have to wait. So there's a kind of the patience and the waiting that's necessary. And then down the road, you kind of have to put in the consistent effort and then kind of just believe that you're going to get this reward down the line. And that's often the work of the therapist, is to foster that hope and sort of say, your efforts will pay off. Right?
Mhm.
And then once people buy into that idea, then it's like, sure enough, they go back and say, oh, wow, there's a tree there. That's great. So yeah, I think that, the metaphor of growth and rewards paying off over time is a good one when it comes to recovery from mental illness.
And I love how you tie that into your quote. That's perfect. Well, thank you so much again for your time today. It's very clear that your passion is there, your breadth of experience, and Ellie's Place is clearly just very, very happy to have you on the team. And again, thank you for your time.
My pleasure. Thank you very much.